Hello, dear friends. It's Dr. Sarah. Today, we're going to focus on a topic regarding substance use disorder or SUD. And I want to talk about the emotional aspect of recovery from substance use disorder and why that's so important to support, and how essential oils can aid in emotional resilience, nervous system dysregulation, and also mental health when someone is recovering from an addiction. Now, all of the references, the resources, and the link to the study will be available in the accompanying article, as well as some additional free resources on essential oils and holistic health that you can access. So be sure you check out the link in the video description. Okay, let's get started. So right now we're in a mental health crisis in America. According to the most recent statistics of people 12 years and older, within the past year, 16.8% or 48.4 million people have struggled with a substance use disorder. And adults in outpatient treatment frequently report that they have high stress and anxiety, depression, emotional discomfort, and difficulty feeling at ease. What this shows is that true recovery isn't just about eliminating a substance. For lasting effects, it also involves regulating stress, stabilizing mood, and rebuilding emotional resilience. When the nervous system is dysregulated, it can be really hard for someone in recovery to access some of their inner resources. Cravings can intensify, triggers may feel too overwhelming, and engagement in treatment often does decline. So, this highlights the importance of providing that emotional support and stabilizing that nervous system during the recovery process. And this is where integrative non-pharmacological tools can provide meaningful assistance because they offer additional ways to help these individuals manage their stress and to regulate their emotions as they work towards lasting recovery. Many of you probably have had experience with someone with substance use disorder, or you yourself have struggled with it. So you know how hard it is to actually recover and to watch people recover and to deal with all of the emotions that come when someone is off their substance. So one of my favorite holistic approaches to supporting my naturopathic and functional medicines clients' mind and body is, of course, essential oils. Aromatherapy is a powerful modality because it engages our olfactory limbic pathways. So basically, the pathway between our sense of smell as well as with the emotional component and memory component of our brain. And what this does is it connects our scent perception directly with the regions responsible for emotional processing. Clinical and preclinical evidence has suggested that when we inhale essential oils, such as bergamot, it can reduce anxiety, it can improve mood, it can influence hormones, neurotransmitters, and stress-related biomarkers. So this is a way that essential oils can potentially offer calmness to the nervous system and be used alongside conventional care for people with substance use disorder. That's why when I ran into this 2025 research study using bergamot as an adjuvant to standard of care, I was intrigued and I wanted to share it with you. What the study entailed was the use of bergamot essential oil because it was known for its calming abilities and how it impacts the mind and body. So the researchers chose this. And what they did in the study is they enrolled 100 adults diagnosed with a substance use disorder, and they assigned them to either standard care alone. There were 55 in that group, and then standard care plus the bergamot essential oil. There were 45 in that group. And what the people did with the essential oil is they were told to use a personal aroma inhaler at 3 inhalations 3 times a day for 7 days. Each inhalation was to last 3 seconds, followed by a 3-second breath hold. So basically, 3 times a day. And what this method was it was a simple and structured way. So researchers had an easy way to measure the results and the dosage. So that's why personal inhalers can be super helpful in these kinds of studies. What they also did was used validated questionnaires to determine the psychological outcomes related to the use of the essential oil. They used the generalized comfort questionnaire, the ease measure, and the depression, anxiety, and stress scale. And all analyses for those who are into research were according to intention to treat approach with statistical significance defined as p-value of less than 0.05. If you don't understand that because you're not in research, that's okay. Basically, it was using validated measures with a really good evidence that it wasn't just by chance. So there were several broad themes across these different questionnaires that they were analyzing: psychological ease and comfort, depression, anxiety, stress, and adherence and safety. And at the end of the 7 days of the study, what they found was almost all intervention participants, which is a really high number, 98% of them, used the aroma inhaler at least 3 times a day, and 81% maintained a logbook during the study. And there were no reported adverse events or urgent psychological or clinical interventions required. What they found was that emotional ease increased. And that's important because we know in recovery, even modest improvements in regulation can influence how someone navigates cravings and triggers. They found a decrease in depression, anxiety, and stress. And this was just after 7 days. So for a low-cost non-pharmacological adjunct, it's noteworthy because many people that have a substance use disorder, when that's treated, they often realize they also have an underlying mental health disorder, or the mental health disorder can actually make it harder for someone to quit a substance. So having an intervention that touches upon these two aspects at once is very powerful. And as far as how the bergamot actually worked for those interested in the mechanisms of action here and how essential oils could be so impactful, because they act directly at the limbic brain at the level of stress processing, that means that when we inhale essential oils, they can act quickly. They can influence our physiology as they influence our emotions simultaneously. So they're working on those stress pathways. And they're also supporting our nervous system regulation and our hormone balance because they're impacting our perception of stress and our biological responses. Bergamot specifically has been studied to interact with these GABA receptors, which are a calming neurotransmitter. They also, the essential oil has also been shown to influence the hypothalamic pituitary adrenal axis. So that would impact stress and hormones, which we know have an effect on the brain. And then just helping to regulate the body's stress response with emotional calm. I've also reported studies. If you watched my previous video on heart health and single essential oils, I talked about bergamot essential oil for its ability to calm the nervous system and regulate the heart-brain connection. And I think that the way that this study was carried out by the use of personal inhalers was pretty genius, in my opinion, because it, as I mentioned a little bit before, it had controlled dosing, portability, privacy, immediate access, and a sense of autonomy for someone with substance use disorder. So I think that that aspect is very important because you never know when a trigger is going to occur. So if a person has that at hand, that's important, as well as just taking the pause to breathe. That can be regulating to the nervous system. Now, this all seems wonderful, and it is, but there are some limitations because we can't always take one study with a certain population and make it generalizable to the whole population because everybody's different and they have different individualized needs, health histories, and different co-occurring symptoms or diagnoses. So some of the limitations were that it was short, it was only 7 days, so we don't know how the participants would fare after a longer period of time. There was not the biggest sample size, it was 100 people, but they also relied on self-reported outcomes and those psychological measurements, which were good, but the feelings of self-ease and all of that is more of a subjective rather than an objective measure. But I think that this research is very hopeful and it might encourage other research for larger studies with larger populations where they can measure objective measures such as cortisol and inflammatory markers, because inflammation is linked to mood disorders. What I take away from this study is I kind of add it to the repertoire of what I've seen over the years of how important essential oils are in my toolkit when I work with my naturopathic and functional medicine clients with their mental health and their stress support. And I feel that essential oils are so powerful because they impact that emotional processing, that psychological and physiological stress response, autonomic tone and parasympathetic activity, and psychological resilience all at once. And that's why I incorporate them into people who are struggling with maybe breaking even different behavioral patterns or breaking habits or just trying to act more healthy with their lifestyle, as well as dealing with addictions. And when they're used as an adjunct or complementary treatment, they can support therapy engagement. They can reduce emotional intensity of feelings as someone is healing. They can enhance the stress resilience response and improve adherence to treatment because there's less stress and triggers. Someone just feels more at ease. So I do have two additional posts on addiction and essential oils and two client case studies that I have that I'll link in the article. So if we summarize about this key takeaways of using bergamot essential oil to support the recovery process, we looked at a 2025 study that used bergamot essential oils 3 times a day for just 1 week. And it was for patients, an outpatient sud treatment, and it found that they felt calmer while also reducing symptoms of depressions, anxiety, and stress. The effects were modulated by bergamot's ability to impact GABA receptors, regulation of the stress response, and support overall nervous system balance. And I think it's really encouraging because we know that by soothing the nervous system and promoting emotional regulation, it could be a really powerful complementary tool alongside traditional treatment because it's addressing that emotional resilience and some of those additional mental health issues that people struggle with recovery. I hope that you found this information helpful and that you share it with other people who might need to hear this. I'd also like to encourage you to please subscribe to my channel and to make sure that you get on my newsletter and access some additional free resources so that you can empower yourself even more for holistic living and using essential oils in an evidence-based and safe way. I wish you many blessings.